Hello, I welcome everyone to the Dentium Live Surgery Show. Before we begin, on behalf of all of us at Dentium, I would like to send our deepest condolences to the families who lost loved ones in Itaewon, Seoul. We send our best wishes for a quick recovery to all those who were injured. Dentium Live Surgery Show, as you know, visited worldwide Dentium users twice a month with cases on various topics. Today, just like last time, we invited Dr. Zhang to have surgery. I would like to thank Dr. Zhang for all his hard working on every Dentium Live Surgery Show. This live surgery keeps on giving to us. Today's topic is implantation on narrow ridge with pin guide system. I expected that this procedure will be of great help in your clinical practice. Thank you. Let's take a look at today's case. The topic is, as I mentioned before, implantation on narrow ridge with pin guide system. About the patient information, 72 years old male patient, the chief complaint was, my front teeth are moving. Lower front teeth was moving. Past dental history, implantation on number 16, 36, 37, 44, 45, 46 area. Already done all the implantation with the zirconia superstructure. He got the past medical history about the stomach cancer, but recover now. This one is a panoramic view pre-op of the patient. As you can see, upper anterior and lower anterior teeth was moving, and periodontal compromise situation, the poor condition, so poor prognosis also. Especially today, Dr. Zhang want to have implant surgery on lower anterior teeth simultaneously with the extraction. About the cone-beam CT, as you can see, number 42 area very narrow. And number 33 area, the teeth are moving, and also the width is available, but the labial bone plate was lost already. Intraoral view, intraoral situation. As I mentioned before, upper anterior and lower anterior is poor condition, especially today, focusing on lower anterior. As you know, number 43, 32, 33 is hopeless teeth, should be extracted before surgery. Surgery plan was 33 and 42 area, the implantation with the GBR and gap filling, actually, a gap filling procedure with the bright tissue level implant. Extraction number 32, 33, 43, all the bridge work should be removed and extracted, and the implantation on number 33 and 42. And when the Dr. Zhang have a gap filling and socket preservation procedure, he will use osteon-free collagen and collagen graft too. Okay, let me introduce briefly about pin guide simple kit. Actually, this one is brand new kit from Dentium company. This kit available for to recognize information about the shape of alveolar bone, the geometry of alveolar bone with this pin guide simple kit. So we can the clear understanding the bone morphology when you have implant installation. Compared to using digital guide, we can get another advantages compared with the digital guide. What is this? Actually, I will explain later during the surgery. I will introduce and explain about these advantages of pin guide simple kit system. So this simple kit of pin guide system is optimized to flapless surgery. Combined with the flapless surgery and the bright tissue level implant with this pin guide system is a fantastic combination for getting best result. So this one is diagram for the pin guide system. More comprehensive understanding, as you can see, the three different the angled pin guide available. And about the bright tissue level, as you know, for simplified surgical procedure and easy installation and getting better initial stability and the minimize bone grafting procedure, all of these advantages combined with this tissue level of bright implant systems. When you choose this bright implant tissue level system with the narrow reach, you can get the getting better result and reduce the bone grafting procedure. So maximize the result and minimize the surgery field. About the osteon 3 collagen, actually this osteon 3 collagen is a best seller for the bone grafting at the field, as you know. So this one is almost maybe more than 10 years. We can use very frequently socket preservation and GBR procedures and gap fillings and so on. So today also Dr. Zheng is going to use osteon 3 collagen for gap filling. Osteon graft 2, this one is actually a porcine origin, porcine tendon origin, derived type 1 collagen. So this one is faster soft tissue healing and the organized and the soft tissue, promoting soft tissue epithelialization. So sometimes we can get the augmentations, soft tissue augmentation effect when you use this collagen graft 2. Okay, let's see similar case 1. For comprehensive understanding, as you know, let me introduce about very similar case to today's surgery, immediate implantation and gap filling. So as you know, upper anterior teeth, the fractured, already done by root canal treatment. Root canal treatment teeth is the candidate for immediate implantation, as you know, the best candidate. So we always checking out and observing this root canal treated bridge work and the crown and the long span bridge. Extraction and the gap filling with osteon xenograft and drill and checking the path and implantation with bright tissue level. Very simple procedure. And the connecting with the healing cap for intraoral scanning and suture. That's it. A very simple procedure, and however, more effective than any other implant system. Healing 1 week situation, a very nice healing, cause of due to minimized flap reflection and the minimalism treatment concept. Okay, what about this provisional restoration? I think this provisional is very nice, well done by tissue level implant. Soft tissues are healing well, and final restorations here. And this one is panoramic view. As you can see, very nice, well-organized marginal bone area, and the fixtures are still there, a very healthy situation, and also the superstructure, zirconia bridge work is a very nice situation. Intraoral view of the patient, the marginal gingiva, interproximal area, and the interproximal area, the papilla, all the situations are very nice, well organized, and well done. Okay, another case, similar case too, the very similar, narrow ridge implantation with the anti-eye, the lower anterior, the extraction, and the pelvis drilling, and the implantation. That's it. Very simple procedure, as I mentioned before. So if you want to have a pelvis surgery, please try with the tissue level of Bright implant system. The very convenient and easy, simple procedures are next door to you. Okay, about the narrow ridge implantation already done and temporarization. The ordinary provisional restorations can be made after 1 week or after 2 weeks of surgery. Why? Because of this implant system getting better in a higher insertion torque. So after insertion, after soft tissue healing, we can get the provisional restoration. We made provisional restoration to your patient comfort needs. Okay, final restoration here. And the X-ray view, very nice marginal view situation. And the osseointegration, the very nice, well done also. And this one is panoramic view of the patient after final prosthesis delivered. Okay, let's move to surgery room for watching the today's surgery. Okay, Dr. Jung is checking extracting the teeth. Okay, sometimes Dr. Jung is using the explorer to separate the soft tissues from the root surface. These actions like as cutting the gingival fiber of the soft tissues. Okay, all around the soft tissues are checking and gingival fiber cutting, and the simple extractions are here. Cause of already periodontally compromised teeth with a bridge situation. So the remnant of the root and remnant of the bone is so soft and weak, and easy extraction already done. And now the saline irrigation here. Today also, Dr. Jung is going to have a pelvis surgery using with a Bright tissue level implant system. All of these procedures are based on the minimalism concept. Nowadays, Dr. Jung proceed the minimalism concept on the patient narrow ridge. Okay, the granulations, remove the granulation tissues here. Basically, in this kind of, in sort of this case, 33 and 44 areas is best for implantation of 2 implant fixture installed, right? However, Dr. Jung is going to have a number 42 area instead of number 43. Cause of this number 43 areas is uncomfortable, not favorable for immediate implantation. So Dr. Zheng want to have a higher insertion torque with a minimized bone grafting. Okay, now he is using the pin guide. This pin guide system is watching all the geometry of the alveolar bone on the surgery site. The lingual side pin inserted, and the labial side, another pin is inserting. When you have inserting the pin from the kit, the actually labial side starting with the mucogingival junction. From the mucogingival junction, checking the insertion point and choosing the pin, the proper angulation pin, and inserting the filling the slope of bone. With filling the slope of bone is very important. The pin should be located between bone surface and periosteum for the accurate bone geometry. Okay, after insertion the pin, checking the bone profile and starting the drill with a high-speed Fisher bar, right? The pin, the three different types of pins are in the kit. First one is straight, another one is 15 degree, and also 25 degree. Depending on the slope of alveolar bone, you can choose straight 15 or 25 degree. Dr. Zheng is choosing a 15 degree of pin for a labial plate, and the lingual side, actually a straight type pin was inserted. And after that, starting with the Lindemann drill for proper positioning. So basically, as you know, these pin guide systems are based on the bisecting angle, the concept, right? So checking the sounding, the remaining the bone shape, whole bone shape here, and checking the labial and lingual surface. And the pin have there's a different direction with a different degree. So between the labial and the lingual pin, the bisecting angles is proper positioning to have an implant insert, right? These basic concepts. Okay, this probe checking the insertion point, making an insertion point, and after that insert pin like here. So this pin, the almost straight, looks like straight, but I'm not sure the straight or 15 degree. I think, yeah, seemed like 15 degree. Yeah, 15 degree angled pin inserted on the lingual side of number 33 area. This number 33 area is the socket, right? So Dr. Zheng checking the socket and making a proper angulation with the Lindemann guide drill and the full depth drilled osteotomy. Actually, he want to have wall, the mesial and lingual wall of the socket. Cause of this area is number 33, the canine area is a big socket. So lower anterior is not. It is impossible to have a big size, big diameter of implant fixture. Cause of bone biology, as you know. So 3.0, 3.5 is optimal diameter of implant fixture. So Dr. Zheng have decided using this mesial wall and the lingual wall plate to getting the insertion torque Okay. Checking the pass again. I think yeah, good position and very nice. The angle, the angulation. And again, the Lindemann. Compared to a digitalized stent, like a stent guided surgery, digital guided surgery, what is big difference? Actually, first, time saving. If you want to have digital guide surgery, you need more time, right? Taking an impression, making a model, and CT, and merging each other, scanning and merging each other, and using the program and all the proper positioning, the watching and seeking the proper positioning, and seeking the proper diameter and length. All these procedures should be first, and then go to 3D printer or the milling machine to make a stent, and then coming back to my clinic, need 5 days, 5 business days maybe. However, like this immediate implantation situation, this pin guide system is better than the digital guide system, right? 这是拔牙后即刻中诊 So pin guide system is better to 拔牙后即刻中诊 Immediate implant system after extraction, right? So I strongly recommend you, when you want to have immediate implantation after extraction, you can use this pin guide system instead of digital guide. Okay, after positioning, number 33 areas, the osteotomy is doing. Okay, this one is osteon 3. As I mentioned before, this the hybrid type, the collagenized bone graft materials. The particle osteon 3, same as osteon 3, and the collagen binder holding all these particle bone graft materials. So this osteon 3 collagen is better performance to have this kind of socket preservation and GBL procedures, and sometimes ridge augmentation or just a volume up cases. Nowadays, this collagenized bone, like osteon 3, is available, the prevailed in the bone graft materials market. Okay. About filling the gap, according to some reports, bone resorption after 1 year, no filling the gap, the procedure, 22% horizontal loss of extraction site, and 1.7 millimeter vertical loss. This report are available to our field, right? So some of scientists reported already 22% horizontal loss, 1.7 millimeter vertical loss without filling the gap. It means filling the gap when you have an extraction socket, immediate implantation, it's a very important procedure. So how? With what? Actually, like this simple filling the gap procedure is better, right? Fill the gap and shield the success is the motto of some another company. Anyway, the filling the gap procedure is a very important factor to long-term success rate and longevity of implant processes. So after insertion, bone grafting materials like this osteon 3 collagen, very simple procedure. Combined with bright tissue level implant and osteontry collagen is best combination into the socket installation. After that, removing the plastic cap, and he is going to connect a healing cap for the scanning actually. If you have a filling the gap procedure using this collagenized bone, like a sort of osteontry collagen, some reports are available. The 92% horizontal volume can be preserved, and just only 0.6 millimeter vertical loss. Frankly, these are reports from the Geistly, but we can use this information when we have gap filling or socket preservation procedure. But anyway, gap filling is very important procedure again, right? A comfort cap connection here. Let's see. Actually, when we have filling the gap, socket preservation, filling the gap with implantation simultaneously, which one is better? Number one, implantation and the graft material insertion. Number two, the graft material insertion first, and then the fixture installation. Actually, it doesn't matter. The both way, also the same way to go, the socket preservation and filling the gap. I think the very similar result to us. However, the surgeon's preference is totally different actually. Dr. Zhang, like this, the graft material first, and then implantation. His style, his own style, but another surgeon want to have implantation first, and then filling the gap procedures next with the particulated bone, or like this collagenized bone, osteontry collagen. Okay, the finishing all the implantation procedure and the bone grafting, the filling the gap. So 3.5 diameter, 11 millimeter implant fixture, bright tissue level implant fixture was inserted on both sides. This one is collagen graft 2. This collagen graft, very familiar to soft tissues. So this collagen graft 2 promote soft tissue healing, epithelialization, right? Sometimes this collagen graft can be used, the soft tissue augmentation. For best way, as you know, for the soft tissue augmentation, the connective tissue graft is best option, as you know. However, sometimes not available the connective tissue. The procedure, we can use like this alternative way, using this collagen graft instead of connective tissue. Or you can use both connective tissue and then the collagen graft. Both of them are available for making the soft tissue augmentation. Okay, the suture. This suture looks like a horizontal mattress suture. However, not the original horizontal mattress. This one is modified style, as you know. And these sutures making a flap, the closer each other. Okay, all the procedures was done. And checking the surgery site here. Yeah, he need one more stitch about this collagen graft area. Basically, this collagen graft made with the multi-layer collagen. So this porcine origin multi-layered collagen sheet is sometimes easy to resolve compared to collagen membrane. However, as I mentioned before, the higher the preference and the performance to make epithelialization of soft tissues. So promote faster soft tissue healing. This device is the tapping, and you can see the score. After tapping, you can see the score immediately, about 80, a very high score. Yeah, okay. The surgery was done very well, and we will start in 10 minutes after break. Thank you for watching. Let's see the post-op panoramic view. As we can see, the lower anterior is very nice, well done implantation with the NTI or bright tissue level implant fixture connect with the healing cap, the comfort cap, the angulation and location it could be nice. Okay, about the CT scan, the cone-beam CT is showing us about this good situation, well done situation. Number 42 area and also number 33 area. Very nice angulation of well done situation of implantation fixture. And also we can see the focusing on the gap filling, especially number 33 area. Basically, number 42 is healed site, so it doesn't need any bone grafting materials when you use these the NTI, the tissue level implant system with the minimalism concept. However, number 33 is a socket area, and the big socket, the canine extracted socket. So after insertion, we have two gap filling. What kind of material is better? Today, Dr. Zheng is using osteochondrial collagen for gap filling material. So this osteochondrial collagen graft materials compact filled in the socket area. This one is actually the intraoral scanning after 1 week, right? After 1 week. So basically this surgery video recorded with 1 week ago, and now we can see the post-op, the follow-up situation. What is the follow-up situation? As you know, the provisional lacerations inserted to the patient mouth with the CAD design, the provisional laceration setting up, and this provisional laceration with the PMMA delivered to patient mouth just after 1 week. It is amazing. It is unbelievable situation. Why? Very nice tissue healing. The conditions was done. First, the minimal invasive surgery and no flap reflection, right? So flapless surgery and the gap filling and suture and the minimized drill and insertion of implant fixture. All the conditions, all the situation and procedures going to the best result like this one. So we can see very nice PMMA temporization of our patient just after 1 week. Oh, I think it's amazing, the unbelievable situation, the very nice, the well-healed situation. Okay, let's move to the question. Today's question, very good and excellent question. Number 1, what is the good thing about using the pin guide kit? As I mentioned before during the surgery, if we want to have immediate implantation after extraction, so we don't have enough time to make a digital guide stent. How can we proceed the procedure? Yeah, just the freehand style implantation is first option. When you have a freehand style implantation after extraction, like a simultaneously immediate implantation situation, but there are no time to make the surgical stent. This pin guide is best option available to make tracking the geometry of alveolar bone situation and alveolar bone geometry. Using this pin guide system. 2 pins make angulation, and bisecting the angle is proper positioning of implantation. The basic concept here. So sometimes we can see, we can imaging the bone situation, combined with the CT scan and COMBIM CT plus pin guide, right? So pin guide like this, the divergence angle, it means the top portion of alveolar ridge is wide. However, just below the top portion of the alveolar bone have the concavities or some distance defect or some depressions like here. So these pin guide systems gave us information about this bone geometry. It is a very good thing about using the pin guide kit when you have immediate implantation after extraction. Okay, number 2, is there any tips, particular advantages of using osteointric collagen when gap filling? Right. Yes, of course. If we have osteointric collagen, when you have a gap filling procedure, first, actually very easy and simple and time-saving situation compared to particulated powder bone. Why? As I mentioned before, the collagen binder holding all the particles, so not dispersed and not scattered, and just holding the inside of the socket, so the faster and easy. This osteointric collagen also can be available the sinus cavities when you have a sinus elevation, and also the standard GBR procedure to make the bone, the space making and bone volume, right? All these situations are available to use osteointric collagen, the graft materials, instead of particulated bone. So for me, actually, gap filling, I always use like this collagenized bone, the bovine collagen and the artificial, the alloplastic collagen, doesn't matter. Today, osteointric collagen was used gap filling. The simple and the easy and the promoting the healing procedure, the socket. Okay. Yeah. Thank you for watching today's video and today's the surgery. All these situations was satisfied to us. Even though today the special fact is follow up the photos connecting with the PMMA temporalization. It is also the bonus fact for us today. Okay, thank you for watching. Thank you for having me. The next live surgery show will be held November this month, the 18th, the Korean time, 7 p.m. Okay, thank you, and see you next time. Bye.